The first thing what I find myself thinking now, if you ask this tomorrow, there would be another thing that would come first to my mind. But today, what comes first to my mind is that everybody's voice is important.
I decided to travel to the north of Finland to visit the land of open dialogue, the place that is getting the best results in the world for the treatment of psychosis.
Wow, it's the most important.
It's how we work here.
Co-research of problems or dilemmas or traumas.
They get better results than anywhere in the United States, and I was curious how they did their work.
I think it's not the treatment system per se, but I think it's more like a political thing.
I want to see you.
We aim at the democratic system where people can have their say about their own treatment, and that we are kind of try to be on the same level with people and being equal with them.
I'd read some of their research, and their data were undeniably impressive, but somehow I just felt that seeing them in person would be a whole different thing.
Hey, and then you can look up here. I can see you.
It's something that happens between people.
The sister of a patient himself, or the nurse.
Oh, hold on, we need to get the recorder.
To bring their understandings, bring their skills and knowledges.
We are not professionals who had to know everything right away, you know.
Right.
We don't go there like a specialist and after 1 hour we tell family what's wrong with you.
It's a two-way connecting. It's not me treating somebody, but it's something I risk myself when I enter into a conversation.
Who are they? What are they like? Is their fame justified? But perhaps most importantly to me, how would they feel about me? A foreigner, an American, a psychotherapist myself, filming them.
Okay. No, don't look at the camera. Look at them and say, you can talk to them.
This is open dialogue, right?
Yeah. This is real, I hope.
This is the real.
We have the idea of hearing people and creating something together based on that.
Before I left home, I had the opportunity to speak with Robert Whitaker, an acclaimed medical journalist who has been bringing the Finnish open dialogue results to the attention of American psychiatry. It was he who made it clear to me that their outcomes for psychosis were not coincidental, rather that they resulted from a well-designed and well-researched program. So when I go to Western Lapland in Finland, what do you think my mission should be?
Well, first of all, I think it's just a chance to observe. There's so many different people involved in the Finnish story.
You have an entire therapy clinic here, but just one room.
Yes, and that's why we can't we don't have room to meet patients here, and we don't want to meet patients here because this is hospital.
Yeah.
We don't want to say to people who have crisis that, oh, welcome to mental hospital so we can talk here.
It was an interesting thing because when I first came here, I was thinking, I think they work very well with the mental health system. And they're even integrated into the mental health system, but I kept waiting to find out where is the mental health system.
Okay.
Do you understand?
Yeah. Yeah.
And then what I realized
Yeah.
is
It's this.
this is the mental health system.
Yeah.
And I thought, that's actually fascinating. Uh-oh.
It's cool.
When someone calls, when someone needs help, we try to arrange help for him or her right away. I don't say to a phone that maybe we can meet after 2 weeks and then we have time.
But you have to. Uh-oh, you're attacked. That's okay.
I'll turn off the camera.
You're going to be privy to a form of care that really is getting the best outcomes in the developed world, by far.
That's a part of our, basic rules. When the phone calls, you have to answer it.
Yeah.
Take the responsibility for what comes from there.
It is interesting how many of my interviews have been interrupted by the telephone here.
Yeah, because I think that's a question of, being like available to people and serving the population.
Not hospital patients, but people outside hospital. I'm sorry, I have to answer.
You go.
Psykiatrian poliklinikka Vahtala.
You never know what comes from the telephone. It could have been a mother being worried about her child or something, and then I would have had to start organizing things. You never know.
I mean, it's so different there, okay? I mean, if you look at the outcomes, people recovering there, they're not here, in so many other countries. So, basically the world has a chance to sort of break out of this mindset it's in, the world psychiatric system, and do something better. So you're talking about the capacity, the opportunity to tell a story that literally could alter millions of lives if societies would change and learn from Western Lapland success.
So that could have happened right there.
Yeah. I'm very pleased that it didn't happen because I have to be at the town at 2:30. But
Oh, in Kemi?
yeah,
I guess what I'm trying to tell you, Dan, is that I really think there's an opportunity here.
at the town mental health office, I have a patient there with a nurse from there, working together with the patient.
So you're meeting with a nurse and with the patient.
Yeah.
So that phone is a big responsibility.
Yes,
Middle of the night also?
yes.
Does that make sense?
Yeah, it makes sense. And I'm wondering, are there any psychiatric survivors in Western Lapland? I mean, and what do they think of this method? I mean, are there people who are criticizing this open dialogue method, and what do they
In
think?
Finland?
I wonder.
There are some psychiatric survivors in Finland, but more, in the other areas.
Do the patients prefer that you meet in their home, or do they prefer to come to the hospital?
Most of people says welcome to our home, but there are people who don't want us to go there, and then we meet here or some other places. We have in a center of city.
Yeah.
We have another
Oh,
polyclinic
in Tornio,
there. Yes, in Tornio.
in the
Yes,
town.
and there are rooms, more rooms, and we can have a meeting there.
And so you give the patient the choice?
Yes, yes.
But most places have adopted the Western,
Right.
the U.S. model. of
Because
Medicaid.
I've gotten people who bought my other movie in Finland and Helsinki, and they're telling me Finland sucks for psychiatry.
I remember first coming here first coming here, it must have been 1965 or something.
You came here in 1965.
Yeah.
What? So you were 10 years old.
Yeah.
But that's Helsinki. That's not Western Lapland. So it's like they were like, yeah, my brother or I or my child were locked up in a hospital and injected with the same drugs that we're using over here.
Yeah. Actually, outcomes for schizophrenia as a whole in Finland are very poor.
Well,
And that actually sort of shows that it's not just the culture. People say, Western, Finland, they do think it's a much different society. Well, there are outcomes where they have adopted the medical model. And by the way, Finnish doctors are being bought off by by pharma companies too. Their outcomes suck.
right.
I was singing in a boy choir.
For the patients in the hospital?
Yeah. We made a trip here and had a small concert here. And I remember being quite, not shocked, but surprised that there would be also these kind of places in the world.
I mean, one of the interesting things here is this is known as a valley in Finland, this Western Lapland. It actually has a lot of medical problems, okay? And it may have everything to do with temperature, the light, maybe changing economic opportunities. So it's actually a society that's been under a lot of stress for a long time.
So you came here, was it very different from what it's like now?
Yeah, very different. It was very worn out hospital and very in a bad shape in many ways and just chronic patients and smelling bad and everything.
So it was a scary experience.
Yeah.
So for them to sort of reverse this one part outcomes, it's not coming